You know, from the moment a couple finds out that they're expecting, the anxiety kicks into full gear and the questions begin to circulate. So finding a reliable, informative, and comprehensive book on pregnancy can become an overwhelming task. For more than a century, the Mayo Clinic, the gold standard in medical research and patient care, has provided unique expertise for moms and dads in the making. And joining us today is Dr. Myra Wick, one of the medical co-editors of the Mayo Clinic Guide to a Healthy Pregnancy, the ultimate guide and perfect roadmap to a positive pregnancy experience, something that every parent would love to have, but sometimes a little elusive. A little advice goes a long way. Thanks so much for being here.
Thank you.
So first of all, you've got some first-hand experience, let's just say, with pregnancy. You've got 4 children yourself. You've delivered hundreds of babies. Was that part of your motivation for being involved in this project?
Correct. I find pregnancy and childbirth to be fascinating, and it's such a privilege to be able to take care of pregnant couples when they're expecting.
And you know, pregnant couples are often filled with questions. You know, they get so much advice from all different places. How do you whittle down all of that information?
Well, it can be a difficult task, but I feel like my colleagues and I have done a great job of bringing all the important information into the book, and will serve as a great guide for expectant parents.
All right, so the book came out May 1st, we should say, and there are a lot of do's and don'ts that are in the book that give people some really straightforward advice. Can you break some of that down for us?
Sure. We all have some habits that might not be healthiest habits during pregnancy. For example, drinking several cups of coffee a day, or enjoying a glass of wine with our dinner. And so it's important for patients to be mindful of that when they're thinking about pregnancy, and to change some of those habits that might not be quite so healthy before they become pregnant.
Right. Now let's dig into a couple of those. You mentioned the coffee.
Right.
And the limitation in the book suggests that women consume no more than 200 milligrams of caffeine every day. Now, how does that compare to, say, a cup of coffee? 200
milligrams is usually about what you would expect to find in 2 cups of freshly brewed coffee. And so 2 cups, we think, is probably a safe amount during pregnancy. There certainly has been some controversy and inconsistencies in the research and the studies. It's important to remember that other foods besides coffee and tea might contain caffeine, and the book includes a guide, a chapter with information about the amount of pregnancy, or the amount of caffeine in different foods.
Sure. Chocolate was a tough one for my wife to try to cut back on, but there is caffeine in some chocolate.
There is, and even some of the coffee ice creams contain some caffeine as well.
All right, now let's talk about alcohol too. I mean, you mentioned having a glass of wine with dinner.
Right.
You know, I remember my wife was getting differing opinions on this, that you should cut out alcohol completely, or that a little bit is okay in moderation.
Right. Well, alcohol, we know, can cause something called fetal alcohol syndrome, which has characteristic facial features, and more importantly can cause cognitive problems in the baby. And we really don't know what a safe amount of alcohol in pregnancy is, and so we recommend cutting it out completely.
And you talked before about preparing for that pregnancy, and when should women start to cut back on all of these things?
I think it's important to start thinking about healthy choices a few months before pregnancy, because sometimes women aren't aware that they're pregnant initially, and it's really in those early few weeks when all the important organ system formation is occurring.
It seems like an obvious one, but cutting out smoking entirely has got to be some of the best advice.
Right, and that can certainly be difficult, and we're aware of that, but smoking in pregnancy puts a woman at increased risk for miscarriage, stillbirth, early delivery, a smaller weight baby, and so it really is important to cut out smoking before pregnancy.
Now, a lot of women will continue to work while they're pregnant, in fact, right up to almost when they give birth in some cases.
Right.
How does stress play a role in the pregnancy, and how do you manage that, especially for a working mom-to-be?
Right. Well, stress and fatigue can certainly be an important factor in pregnancy, and the book gives some tips about how to deal with stress and fatigue. It's certainly important to rest and get good sleep while you're pregnant, and we have tips about keeping snacks at hand for nausea and those kinds of things.
Now, for any woman who is pregnant right now and they're thinking of maybe a summer getaway or a trip or something like that, what should they know about travel guidelines, in particular which trimester is the best to travel?
Right. Usually women are most comfortable during the 2nd trimester. They're over some of the nausea and queasiness of the 1st trimester, and they're not as big as they might be during the 3rd trimester when you're a little bit more uncomfortable. So 2nd trimester is when most women are most comfortable. it's important to realize that some of the airlines might have restrictions during the end of pregnancy and not wanting women who are 38 or 39 weeks to travel by air.
So it's more about the comfort of the woman or the guidelines with whatever sort of travel mode you're using rather than safety for the baby?
Well, you want to keep the baby safe as well. For example, with car travel, we know that maternal trauma is one of the major causes of fetal death. And certainly automobile accidents can be part of that maternal trauma. So important to be safe, using safe seat belts on the lower part of the abdomen, between the breasts with the upper safety belt, and being safe during travel.
Lots of great advice in there, so much to go through. So thank you so much for joining us, Dr. Marwood. We appreciate it.
You're welcome.
And if you need any more information on this topic and plenty of others, just log on to the health page at abcnews.com for all the latest health news.